Dr. Anthony Fauci has said that in the United States, the way our systems are set up, it's just not designed to ramp up instantly to the level of mass diagnostic testing needed for the response to the COVID-19 pandemic. So while some of the initial delays in laboratory testing were related to technical and regulatory issues with specific diagnostic tests, the fact that states have struggled months into the pandemic to establish diagnostic testing at the community level has a lot to do with the way that laboratory services are organized in the U.S. While we do have a federal regulatory system that oversees the quality, the reliability, and the accuracy of diagnostic testing all across the country, we don't have a truly integrated national laboratory system. Instead, we have a lot of parallel systems. We have clinical laboratories that are associated either with hospitals and hospital systems or that are private commercial laboratories that conduct the bulk of diagnostic testing in the United States to help clinicians manage individual patient care. These are primarily organized by private sector managers, and they generally have an agreement with hospital systems or with healthcare providers ahead of time that helps them streamline the process of sharing information, everything from who's ordered the test to where the results should be reported to who will cover the costs, which is a significant management issue in the way that the U.S. healthcare system is organized. These systems are high quality, they're efficient, but they're essentially parallel and not coordinated. There are public health laboratories in the United States. There's at least one central public health lab in every state or territory, as well as some local labs and some public health labs at the federal level that conduct advanced testing and support reference testing. These exist specifically to conduct diagnostic testing and training for conditions that affect population health, which would include infectious disease outbreaks. And many of these labs are actually already firmly networked through a system called the Laboratory Response Network, which was developed specifically to streamline testing for unusual biological events, as well as being connected to their local, state, and national public health authorities for information sharing. But they regularly conduct only a small fraction of the tests in the U.S. every year. And because they're already limited by chronic challenges in funding for staff and equipment, they just don't have a lot of surge capacity to increase testing capability quickly. And expanding the number of labs that are conducting tests is challenging because each of those labs has to adapt and validate diagnostic tests according to their own equipment, their training, and their certification. So just expanding the number of labs that are conducting tests is also challenging. So ramping up in this system requires logistical and decision support so that you can figure out how to work outside of these constraints in these many parallel systems. And that has been a real challenge.